Tell you about the various impression trays which are used in the dental clinic. What is an impression tray? An impression tray is used to carry an impression material while making impression in the patient's mouth. Impression trays can be used to carry various kinds of impression materials. I'm sure by now you know the various kinds of impression materials. Alginate is a very commonly used impression material in the dental clinics. You should know how to mix alginate as well. Then there is another impression material which is impression compound. So impression trays are used to basically carry the impression material. So now let me tell you about the parts of an impression tray. An impression tray has got a handle. This is the handle of the impression tray. The handle is used to hold the tray in the patient's mouth while making the impression. Then there is the body of the impression tray. This is the body. The body has the floor area and the flange area. So this is the flange area and this is the body of the impression tray. Now as you can see, impression tray for the upper teeth and the lower teeth are different. So let us see what is the difference between the upper or the maxillary impression tray and the lower or the mandibular impression tray. This is a maxillary model. So to make the impression of the upper or the maxillary teeth, we use the maxillary impression tray. The maxillary impression tray has got palatal vault. This vault area is used to record the palate which is present in the maxilla. On contrary, the mandibular impression tray has got the lingual flange area. So while recording the mandibular impression, as you can see, this is a mandibular teeth model. So this mandibular impression tray fits like this and it records the lingual area through this lingual flange. So if you have to differentiate between the maxillary and the mandibular impression tray, it's very simple. Let me repeat it once again for you. Maxillary impression tray has got a palatal vault to record the palate in the maxilla or the upper jaw, whereas the mandibular impression tray has got the lingual flange area along with the labial flange and has not got any vault area. So now that you know about the parts of an impression tray and what is a maxillary impression tray and what is a mandibular impression tray, let me classify the impression trays. There can be various classifications. One is according to the material. So impression trays can be either metallic. So the metallic impression trays can be made out of stainless steel or aluminium, and the plastic impression trays. Then there is another classification. Impression trays can be either perforated or non-perforated. This is a non-perforated solid impression tray. That means it has got no holes in it, if you can see. Whereas these are perforated impression trays. They have got small holes in it. There has to be some importance of these holes if present in the impression tray. When recording the impression material should stay in the tray. The impression should not dislodge from the tray. So the mechanical locking of the impression material into the tray can be easily achieved with the help of these locks. Materials like alginate do not stick to the impression tray. So alginate impression should always be made in these perforated impression trays. Material of choice for these solid non-perforated impression trays can be the impression compound. So the impression trays can also be classified as the stock impression trays. These are all stock impression trays. They are prefabricated. They come in various sizes. The various sizes of the impression trays can be from extra small to large sized impression trays. Depending upon the jaw size of the patient, the impression trays can be chosen for the accurate size. So, for the maxillary, impression tray selection, the size can be checked by keeping it in the patient's mouth like this. We can check for the clearance and the size of the tray. There are custom made or special impression trays also, which we can fabricate in the clinic depending upon the size of the patient's jaw. They would be snugly fitting according to the patient's jaw size. These are disposable impression trays. That means once used, they cannot be reused. They can be only used once in a patient. They are used for the recording of the bite. These are partial impression trays. The metallic as well as these plastic impression trays, they can be reused, hence these can be sterilized also. So to summarize, impression trays can be metallic or plastic, and impression trays can be perforated or